before we don't talk about, I want to record all this is all good stuff. We got to record all of this. So we're recording now. So we can officially get ready to roll. So I'll just do a quick intro. We are not live, which I think is beneficial only because it's been a challenge to try to find times for grand rounds that fits, honestly, a lot of practitioners' busy schedules. Everybody's coming in at different angles on different time zones. But we are recorded. You guys did our first grand rounds, I think, last July. So talking about that as the year kind of like came and went very quickly, honestly. And as Tom alluded, I think right before we started recording, that having you guys just give an update like on you as humans and your practice. And there's been, I'm sure, a lot of developments like from the professional side of things as that business has grown. And then, plus minus anything that's changed with your patients that can just really, align with, I think, what we're all trying to do. But other than that, I will be quiet the rest of the time and I'll let Tom and you guys get into it.
Yeah, well, I can start it off and reintroduce you guys to everybody, but it's an honor to have you back here on Grand Rounds. Almost a year to the month that you guys kicked it off for us. And for those of you watching who don't know Shweta and Dinesh Raju, Doctors Raju, they are really one of the flagship examples of how to integrate CrossFit into a medical practice. And they're both physicians. Shweta is double boarded in internal medicine and obesity medicine and has an MBA. Dinesh is also, I think, double, if not triple boarded, but I know you're boarded in neurology and internal. Is that right or no?
Neurology, sleep, and headache.
Okay, neurology, sleep, and headache. I was close. I was trying.
Internal medicine is funny, and that's
these guys have been, part of the health movement in CrossFit for a long time, and we've known each other for a long time. So I'm really excited to get an update on what you've experienced over this past year in kind of growing your health hub at GC Healthy Living and hearing about that experience and what it's been like for patients and what you've learned and what you can share with the provider community here with us. So without further ado, I will hand it over to you guys and let you run with it.
Yeah, so I have one really lovely update. So I don't know if you remember, but last year we had a patient join us.
Oh, yeah.
Mr. Rippy, who's also like a family friend. He's a 5th grade teacher and taught both of our children. So he's still training in CrossFit at the affiliate that we had introduced him to last year. But just this past month, he sent his mom to us at GC Healthy Living. And so I did an intake visit and then a follow-up, and she did her first training session with us last week. So I think that just kind of highlights exactly what we're trying to do here is help everyone in the community to understand how this methodology can be applicable for themselves and their loved ones to improve their health and longevity.
Yeah, I mean, just to think about that too, right? It can be so hard, and we talk a lot about this, like engagement with preventative care in medicine, right? But using his experience and the experience of our community and fitness to help people become engaged in like the primary pillars of health, right? That they need to work on is just such an exciting concept that they can leverage it. That is so cool. He was such a lovely guy.
Yeah, he's great.
Yeah, that's really neat.
And he's improved so much. I mean, I saw him recently. He's improved so much in his own fitness and just down to clothing sizes and feels really much better in his own body, which is really, what it's all about.
Very cool. Well, tell us what you've been up to at GC Healthy Living. You got a new backdrop. I feel like the space is clean. You guys are holding events. So just tell me what's going on.
Yeah, so go ahead. You
it's
start.
Interesting. The first grand rounds we had was actually in this room, but before it was office space. And now it's actually a small gym. So I'll kind of take you through how we first started. When we first met in grand rounds, we were about 4 months into GC Healthy Living.
More like 2 months.
More like 2 months.
Yeah, we just launched it.
Yeah, the inception was in April, May,
yeah.
And then June, July is when we started getting our first set of patients in. And we initially had a big upswing in the number of patients that joined the program. But after a while, we had a plateau, then an attrition, and then we started to take a look at what we wanted this program to become. And initially, we wanted to bring patients in from our clinic quickly into a CrossFit space to get them more active in the fitness space. But we started to realize that that wasn't working well because many of them felt it was too much of a jump to go from being very unwell to going into a CrossFit space where more people were active.
Mhm.
So we took a step back and we asked ourselves, well, if we can't take them there, where can we take them? And what we started to realize was that when our patients were in the room with us and we started to talk to them about fitness and exercise, we would just tell them, do that, and then come back in 3 months, let's remeasure your cholesterol or your blood pressure or whatever it may be. And we started realizing that was not working either because we were telling them to do something, but we weren't telling them how to do it. For example, Shweta, as a primary care provider, could tell a patient, well, I want you to do metformin 500 milligrams twice per day, and let's check your HbA1c in 3 months. And if you're on the right track, wonderful. But when she was saying to them, well, I want you to exercise and I want you to work on your nutrition, patients would come back taking the metformin, but they were not seeing that synergistic effect that we were expecting with fitness and exercise, fitness and nutrition. So we started thinking about this and we started to incorporate more experts into our network. And so maybe you can talk about how the team built and then kind of how things changed physically.
We had always worked with a nutrition coach who had been in the CrossFit space, and I had been sending her patients virtually for a number of years prior to us setting up the physical space here. So she got more interested when she saw that, patients were asking questions about lifestyle, and so she started working with them on the nutrition side, and then we did a little bit of personal training here in the clinic. And so, I think that what we found was that there are quite a lot of people who are really interested in this methodology. They want to learn a new and interesting and different way to move their body. But as Dinesh mentioned, just we're not comfortable to make that jump from the clinic exam room into an affiliate. So we sort of started to fill that need while still, we still train in an affiliate. And so definitely we understand that this is like the long-term consistency phase, right? So being in an affiliate, training 3 to 5 times a week is the way to maintain or improve your fitness over time in a time-efficient way. And it's more affordable as well. So we still sort of have that as our end-to-end goal. Is like, how do you start from someone who is not exercising at all to get them to that stage? And I think that what we've seen over the last year is like, depending on the person, is like you can kind of move them into these different pathways, again, based on where they're starting from. And so we have, like, for example, some staff who are training with us now in the affiliate that we train in. And so there's just a lot more back and forth from our medical practice into the CrossFit affiliate space. Like 2 weeks ago, we were sponsors for a local competition that benefited Special Olympics, which our police department here organizes. And there were over 40 teams from different CrossFit gyms there. Mm-hmm. And that was really cool because we, again, got to interface our what we're doing here on the medical side, on the chronic disease side, with probably at least 24 affiliates in our community from all around the Atlanta area. And so I think there's just been so much education on both sides. So when we kind of look at what are our 3 main priorities right now at DC Healthy Living, I think number 1 is education, almost like at the public health level. So for people in the medical community to understand what's happening in CrossFit affiliates and in this fitness space that we know is effective. Second is ongoing education for our own medical practice. We have 190 staff, which includes 20 physicians and 10 nurse practitioners and physician assistants spread across 17 locations. So, if you looked across the entire practice a year ago, there's probably maybe 5 people who understood anything about what we're talking about here. And now it's more like 50 people. which is huge progress. And they're participating in our events monthly. Many of them are coming to our classes that we host for our staff every week. They've done some of our nutrition challenges with us. So it's like a lot of different opportunities for them to learn about it. And then the third is the direct delivery of services. So teaching patients about what is the right nutrition for them specific to their health conditions, but also just generally speaking, what is a good healthy diet? And then second, what is the right fitness methodology for longevity and improving chronic disease or helping cure their chronic diseases.
Amazing. Yeah, I have one observation, then a couple of questions I want to get feedback on you guys from. So I think the first one that's really important, and it's something I know that Jen and I have experienced too, is that when you're creating something novel, like in any business or entrepreneurship or even within your medical practice, it's important to be able to recognize when you need to pivot and not be married to the initial concept of what you thought it was going to be. And it's a fine line, right? Because you have to stick with it long enough to understand that there are components of it that aren't working, that it's not just, getting the wheels turning. But you also have to be comfortable enough with yourself to say, okay, well, this wasn't the best approach. How can I change what I'm doing here to be more effective, right? Because ultimately it's a results-oriented situation and we want to help more people. And if the design or the execution of what we're trying to do is not engaging people, then that needs to change. So I think you just need to be committed to do that. And as people think about where they start, you should expect that where you are in a year is completely different than where you started. That's just the nature of the beast, right? So that's the first thing. And then the other two things I wanted to ask is, and I'll let you guys answer this one. Talk about the process of how you've gotten and shared more education with your staff and started to get more engagement. Was it just because, when you're proselytizing and trying to pull people along and screaming, right? Physicians are extremely hard-headed, right? And we're not a group that likes to be told that we don't know how to do things or you got to do it this way or that way. And so there's just this immediate defensiveness with how we move through the world, especially in our clinical spaces. So just talk a little bit about what that experience was like for you guys as leaders.
So, Tom, I think you'll appreciate this a lot. You remember when you were in clinical practice and a drug rep would come to you and say, Dr. McCoy, I really want to just talk to you about this new drug, which I think will be a great thing for your patients. And I want to give you some pamphlets, and I want to give you some coupon cards, and I want you to give it a try. And I'll come back and give you coffee in a few months, and we'll talk about it and see how things go.
Yeah.
My intentions are very good as a drug rep to come and talk to you and say, I have something that you may not have ready access to or knowledge about because it's recently recently FDA approved.
Right. And I would say, yes, you do have something I want. You can leave the sandwiches on the table and get the hell out of my office.
Exactly. So for me to get your time, which is your most valuable commodity, as a physician, is really hard. So what we were really struggling with is we kept going, I think, backwards. So we really had to pivot in the last maybe about 5 months or so. So the initial understanding for us was, let's take people who are in the CrossFit space and bring them more into the clinic, and then use them as a way to bring patients back into the CrossFit space. Mm-hmm. We realized that was a really hard thing to do. Mm-hmm. The reason is that when someone who's actively in the CrossFit space goes into a medical practice, it is very analogous to a drug rep going in and saying, I want to share with you something that's a really great idea. Things that you believe that you already know, things that you already talk to patients about, but maybe I can help you deliver that. And it's very hard to make that connection because it's very analogous to a drug rep. Like, how do you develop a relationship? So we realized that was not working for us. We were not doing a good job going into different offices, even as physicians, saying, hey, we want to offload you with your patients for nutrition and fitness as adjunctive treatment for your patients. And so we realized that was simply not working because the doctors didn't know how to convince the patients to come into the program. So we said, you know what? Who's the best person to educate patients? It's participants in the program.
Mhm.
More so than us using a point of authority to say, hey, I have this credential, come and give me your patients.
Mhm.
So what we decided to do is we started to change our focus and to educate our healthcare providers and our staff by having them be a part of the program.
Mhm.
Because when they become a part of the program, they saw their own metrics change and they became proponents for it. And they had language to be able to talk to their patients more effectively to say, this is something you need to really start to consider. So that was the biggest pivot that we made, is that instead of going from the box to the clinic, we started going in the clinic, going out back towards the box, if that makes sense.
Absolutely. And I think the reason why I asked is that we've asked this of other groups that have been successful in similar ways, and they essentially said the same thing. You know, how did you get the buy-in from C-suite or leadership to do this work? And it's like, we got them in to do CrossFit, and then
Yeah.
it takes care of itself, right? But to your point, you know, you transitioned from, you know, the more paternalistic, do as I say, top down, this is the way to do things, this is right, you're wrong mode, which automatically puts up defensiveness, to honestly, if you can bring individuals from the program in, right, it's much more of a social proof, right? And then the patients and other people can relate. To get the initial providers in, when you had them start doing it, did you incentivize them? Did you give them the afternoon off? Did you compensate them? Like, how did you do that?
Yeah, no, we just gave them opportunities. So, basically what we said is that if you're a staff member, whether it's physician, nurse practitioner, physician assistant, or medical assistant, regular front desk staff, whatever is your position in this company, if you want to participate in any program or service that DC Healthy Living offers, the clinic will cover the cost of that.
Amazing.
So when it comes to we have 2 staff classes in 2 of my office locations, and we just run them immediately after we finish the day.
Awesome.
So people just change and come over, and it's like a 30 to 40-minute class, and they just go home. So that has been really effective because it's easy. Like we don't have to worry about showers or any of those types of things. Doesn't work for everyone because, not everyone can stay late after work, but that's worked for a good number of people. And the other thing is that when it comes to the personalized services, like we have an online fitness track where they get mentorship from a coach to execute the workouts, or our nutrition coaching, again, they just, as long as they're participating, we'll continue to pay the coaches whatever is their time that they're spending on it, but we don't ask the employees to pay anything. So it's like a benefit.
That's awesome. What a great idea.
One of the things that really accelerated it was like a nutrition challenge that we ran in February of last year through the Healthy Steps Nutrition framework, and that really engaged a lot of people. And then we did a ruck in the middle of that, so that there was a fitness component. We had like a little fitness component as well, like a weekly movement and weekly challenge. But then the ruck was really a great community in-person event because we are spread out across different locations, so we don't get to see each other in person every day. And then, I think it's been sort of like not exactly a domino, but one person talking to another person, talking to another person. So like a few staff came to Murph last year, or, this year we had like a little in our parking lot, we did a staff outdoor competition about a month ago. And so, they talk to each other, they see the videos afterwards, and it becomes more like concrete as to what we're talking about when we say there's a different way to pursue fitness. There's a different way to move your body. It's not the same as just getting your steps in.
Yeah.
Which is unfortunately where most people's knowledge about fitness, even in the healthcare space, currently is. It's like they don't understand why they're getting their steps in and they can't lose the 75 pounds.
Right.
A few other things.
Go ahead. Good.
Is we did a few things. One was we really focused on educational meetings and seminars at lunchtime at the clinic. Also right after clinic, and after our staff classes. And in the staff classes, we also invited patients to come in, almost like a drop-in, to come and hang out, and we would work out.
So those patients are only patients who, again, have at least been through some of our fitness program and that we feel comfortable, to bring into a group setting. Because if we really thought they were ready for a group, we would just send them off to an affiliate, which we still do. I mean, all the time I talk to patients, I'm like, let's look up your zip code and see, where, like, if they're ready for that, then they don't need to be training with us in the clinic. They should just go do the thing. But yeah, we still have a handful of patients who either can't afford ongoing personal training or are kind of moved beyond, or they really like the social aspect after they've attended a ruck or another community event. So they are doing, a couple of times a week in the group class that we run in the clinic. So now it's really fun because we have doctors, patients, and staff in the group class.
We also have, we talked about the ruck
Yeah.
for more of a community building so people can just spend time together. And we've been able to actually lucky to graduate some people out of the program into local CrossFit boxes.
Yeah, it's so amazing.
And then, the great thing is we still have touch points with them because they're still our patients.
Yeah, it's our patients.
And we
Yeah.
get to say, hey, how are you doing? How are your metrics? And so there's a longitudinal relationship, even when they're not in GC Healthy Living.
Yeah, or sometimes they're still doing nutrition with us, but they're doing fitness in a different space. So, I think when we talk about, I love what you said about being willing to pivot, but I think also it's helpful when those situations come up where you thought this would work and this didn't work, or you thought you didn't expect this to go as well as it did, which is a lot of what's happened to us.
It's great.
Let's try this. Or somebody on the team will be like, let's try this. I'm like, that's never going to work, but okay, we'll try it for a month
works.
and then it takes off. Is that I stay really focused on what is my mission for this work, which is to get more people doing the thing. And what is the thing? It's like eating 3 meals a day, prioritizing protein and fruits and veggies, minimizing their carbs, minimizing alcohol, minimizing all the things that we know are not good for their metabolic health, and then training enough that they're getting that 150 minutes a week of cardiovascular stimulus, as well as strength training that hits all the body groups and all the muscle groups, and then some higher intensity. And I still haven't found anything over the last year that achieves that, again, more effectively, more efficiently, and more cost effectively than training in a CrossFit box 3 to 5 times a week on the fitness side, 100%.
Yeah, I think that, people who don't understand the comprehensive nature of the methodology and think that it's just a gym don't realize the value on what you're getting. And a well-run affiliate with coaches who know how to kind of integrate the methodology into what they're doing every day, because it's comprehensive, it touches everything. Can you talk about, because I'm interested with this because it sounds like there isn't one on-ramp for patients who are trying to engage in, that side of the practice with you guys. Can you talk about the different ways that people come in? Now, there may be some people, like you said, who are ready to just go to an affiliate. It's close, it works, they're comfortable, they've done some fitness before maybe, and they can take that leap. What does the process look like for other folks? Are they doing one-on-ones for a period of time? Do they go right into group? Do they do kind of movement standards first? Can you break that down for us a little bit?
Yeah, so again, this is an adjunct to what we provide in our primary care clinic. So as of now, it's really a lot of times session to session or month to month that they're kind of seeing where they are and we're reassessing. And not only in terms of how they're progressing with their fitness and their nutrition habits, but how are they doing on the medical side? So we start every patient with a medical intake visit. Because generally they're already our patients. We've had a handful that, again, were referred by other patients or other doctors specifically to do an intake for this program. Or we've had quite a few people, well, I wouldn't say quite a few, but like a half dozen who are already training in a CrossFit gym and heard about what we're doing and want to, maybe optimize some small aspect of it, or they have an injury and they want to kind of get back into it. So once they do the medical intake and there's no reason why they can't participate medically, then we will have them do a lifestyle assessment. And so during that assessment, we can determine, we do an actual fitness test to see where is their current capacity. And then the coach can outline for them what would it look like to get from where they are now to what would be a healthy lifestyle from that. How much education are they going to need? How much actual training would they need? And what are their various options to do that in like a very neutral way? And then sometimes they're ready to start and they'll get started with some personal training with or without our daily online track. And then sometimes they want to think about it or they try other things and then they'll see me back in the clinic. So I think it's, for the average affiliate owner, it's a little bit similar to a lead, except for that we're doing an evaluation as part of that initial conversation because the doctor has already recommended that they need to be doing this lifestyle change.
Okay. Yeah, that makes sense. And you guys are insurance based. Can you talk about how this piece of the practice works? Is that the patients then will pay cash to have access to these programs? Is that more or less how you do it?
Yeah, they have to sign a waiver, and that explains, that these are non-covered services. Unfortunately, we could talk for hours about how ridiculous it is, but so that this is outside the scope of what would be provided in their routine health insurance, and so what we're charging is the standard customary rates for our area for whatever the service is.
And let's just take 1 second to reflect on the fact that insurance companies and the government don't want to pay for you to do exercise and learn how to eat right or be connected to community. I mean, just how unbelievable that is that we put up roadblocks for people to do that.
Yeah. And I mean, it's frustrating, just as a physician, because if I had a payer, whether it was United Healthcare or Cigna or Medicare, tell me, okay, here's 6 months to work with this patient on their obesity. They're paying $1,300 a month for the GLP-1. If they would give me that $1,300 a month, I can guarantee results.
Yeah.
And it's really frustrating to me that with literally the click of my finger, I can prescribe that $1,300 a month medication, which I know is not going to be effective for the long term after that 1 month of medicine. And I know what the potential side effects are and all the lifestyle things that you need to do to make it effective in the long run. But I can't redirect that money to what I know would be effective for them. Even if they didn't lose the weight in 6 months, what they learn in that 1 month that I could provide them with that amount of money would be tremendous. I have no doubt that even the education piece will be tremendously valuable. So yeah, I could go on for hours.
Yeah, I totally agree with you. And it's a very important point though, because body composition changes aside, right? And that being said, if somebody is utilizing a GLP and they aren't lifting, right, they're still going to probably lose a fair amount of skeletal muscle. But even if those things were equal, to your point, what you gain in resilience and self-confidence and knowledge about your own health and how to fuel your body and how to be less dependent on the system, those have a value to the individual that is incalculable, right? I mean, that is fostering true change and growth in the whole person, right? In the whole biopsychosocial approach to that individual, which is how we should practice, right? And we're so good at talking about this, right, as a medical community, right, and as a nation. But when it comes to execution, when you follow the dollars, it's frustratingly poor execution on our part. So yeah, that's challenging. I didn't mean to get on my soapbox there, but
It's hard not to.
I wanted to share I wanted to thank you both for that presentation you gave at HSN. I went back through the slide deck. I was looking a lot at that slide deck, specifically the 2017-2018 WHO study. We looked at the health span versus the lifespan. Looked at America specifically, how the longevity of patients is outstripping their health. So it's almost a decade of extra time where people are with disease. And I took a step back and looked at the American Heart Association and looked at what are their metrics. So they have a nice position statement looking at 8 different things. 4 of them are behaviors, and then 4 of them are lifestyle issues. And interestingly, of all the chronic diseases that they focus on, these 8 things can actually change their habits. Like, for example, sleep, but nutrition and exercise are 2 of those 8 components. Interestingly, there hasn't been any medications that reverse a chronic metabolic disease they are all there to help improve, but not necessarily to get the ultimate goal of getting off a medication, to be medication free. Maybe that's a better term to put.
Yeah.
It's interesting that we are focused so much on using nutrition and exercise as adjunctive treatment, when in reality, they probably should be the base of the treatment.
Correct.
The struggle that we've started to realize, and we had this conversation actually, Shweta made this point that we can probably guarantee that people would get better. But I think that we started to realize it's really complicated. Like, yes, nutrition and fitness is important, but so are, in the right situation, medications that can kickstart people in the right direction and get them off of it. I mean, that's the purpose of these medicines. Yeah. There are some medicines that need to be there forever. I mean, there's some that, at least, for example, in the neurology space, like I can't get someone to outgrow their need for carbidopa-levodopa for Parkinson's disease. Right. But the point I'm trying to make is that there is a role for the medications, like the GLP-1s, a role for topiramate, a role for phentermine, but they're one tool. But the long run is to not need those medications.
Yeah,
so
I think to your point, Dinesh, and I think that the way that at least most of the medical community and how Big Pharma wants you to think about it is whatever it is you utilize to make the improvement in those markers is something that you will need to continue indefinitely to stay where you are.
Right.
And I think that there are various levels of disease and expressions of disease that make that statement not true.
Right.
So most of the time, thankfully, when I have a discussion with somebody about initiating a pharmacological intervention, it includes a discussion about how this is a bridge and what the plan is to minimize our dependence on it or decrease dependence over time or come off of it in this expected amount of time, because we are going to be learning how to do these other things.
Right.
Usually it's because I'm so concerned about your numbers that I really don't want to wait the 3 to 4 months until we really start to see a meaningful enough improvement to decrease your risk of having a stroke or an MI.
Right.
Yeah, blood pressure is 190 or
But that's more an exception to the rule. And I can have a confident conversation with those people that if we do these things in conjunction, this is not something that you have to be. And most people are really excited to know that they don't have to take a pill forever. Most people do not want to take a pill.
And that's another great example of what was unexpected. What was unexpected was how excited the patients were.
Yeah.
We were all focused on convincing the other doctors, but the patients are like, what? Give it to me.
And along those same lines, Tom, one of the real wins we have is we have a box in our other office, and it's only for medicines that people have discontinued.
Mm-hmm.
Oh, you're kidding me. What a great idea.
Yeah. And so like that's an RX level for some people, I mean, getting off of their metformin or lowering their dosage of their statins, it makes a big difference. The side effect.
You should make an entire wall like behind like a trophy case, like in high school, and just empty the bottles and stack them all in there, bro. Be like the backlight of a bar. You can backlight that thing. It would be so cool. I love that idea, man. Oh, it gets me fired up, bro. That's really cool.
I mean, I don't mean to say this in a negative way, but Shweta's mother is a physician as well, and she's been practicing almost as long as I've been alive. And she makes this really interesting story. And she says when she was first practicing in the 1980s, you say that, you tell her that. It's like,
it's just, speaking of electronic records and paper charts and things, it's like she rarely had a patient that was on more than a couple of medications.
Wow.
The medication history was just like, 1 or 2 things because the population was different. Our approach to things was different. I mean, and now you can't even find a patient who's on less than 6 medications.
No, I have one patient.
We're using all this technology to manage this. I mean, there's really no other word for it. Crazy system where we're using like this pill for this number and this pill for this number and this pill for this number. And like nobody is mentioning the fact that you shouldn't be drinking the Pepsi and eating the Cheetos. And maybe you should pick up a dumbbell once in a while.
You guys the articles that we have this month are very time appropriate for this discussion. So one of them is on prescribing habits in America versus other developed countries and the rate of unintended deaths from falls,
Mhm.
and how ours have continued to escalate versus other developed countries where it has actually decreased.
Wow.
We have a study from JAMA that's one of our CME articles this month, and there were, I think it's 2023, there were 41,000 deaths directly attributed to falls that they relate to polypharmacy. 41,000. Think about that. And directly to, benzos, opiates, gabapentin, and other psychiatric medications, right? And when you've worked in primary care medicine and you work with sick folks and folks over the age of 65, it is not unusual for folks to be on all of those medications when they come to you. And we wonder why people get dizzy and fall. It is a hidden epidemic. It really is.
Yeah, and and not only that, but it's like they've never done a burpee. They don't even know how to fall.
Right.
They don't know how to safely fall.
Yeah.
And we talk about this all the time. It's like all the patients are always like, why are there so many burpees? I'm like, it is the most functional movement that you need to learn before you get old, which is like how to safely fall and get up off the floor.
Yeah.
But yes, it's great that the patients recognize it because they're fed up. And this generation, like our generation of middle-aged people, has watched their parents live through exactly what you're talking about.
Yeah.
The doctor's telling them, just take this one more medication, and then you need 2 more medications. And then they're all of a sudden their parents are in a nursing home taking 14 medications, having a fall.
I'm not sure if you guys come across that article looking at the 88% risk reduction of developing dementia in 40 to 50-year-old women if they do consistent weightlifting.
Oh,
Yeah.
Sure.
It blew my mind.
Yeah, that's amazing.
There's nothing in medicine that's 88%.
No.
I can't think of anything that does that. Idiosyncratic hyper-responders to some medications, but I've been now telling all of my patients who have dementia, every loved one that comes with them, I said, if you're in your 40s and 50s, heed my words. Get out there with your family. Go walk, lift weights, be active, talk to your primary care doctor, get into a good nutrition program, because you are bound for a $10,000 to $12,000 per month memory care facility in about 20 to 25 years, because the risk factors are in those families for those habits.
I just want to interject. I got a message on Instagram from an affiliate owner that was like, how my parents were interested in joining the affiliate. They're in their 70s, but their doctor said CrossFit's great, but not for somebody in their 70s. And he's like, help me give them information that will make them see that that's incorrect. Right.
I know, but it is challenging, Jen, because another thing that's kind of come unexpectedly from all that's happened this past year is that we have interacted with a lot of affiliates. We've been to a few affiliate summits with Nicole and with you guys, and then at some of the meetings, like the CrossFit owners meeting. And I think the truth is we have to be honest that not every affiliate owner feels comfortable or equipped to welcome that population. And it's not just the older population, but also the deconditioned population, the obese population, the injured population. And I think that one of the things that we've realized is that we, again, coming back to this educational part, is that first of all, I don't know, we have to have an honest conversation within the CrossFit community. Is every affiliate on board with this health aspect to CrossFit? We see a lot of affiliates that are really focused on fitness and performance.
Yeah.
And we do that really well. Why did you open an affiliate? Because you made it to semifinals and you love CrossFit and you want to train 3 to 4 hours and you like being around other people who like to train that way. And we like to do that. If we had a choice, we would love to go to our class in the morning, maybe see patients a couple of hours a day, and then just go hang out in the gym for 3 to 4 hours. I would be way more fit if I could do that.
But I wanted to answer the question.
Okay.
So I think the question is, my parents' doctor told me don't go to do CrossFit because it's not meant for someone who's 70.
No, she's, go ahead.
Right.
Yeah.
Am I right?
That was the message, right? So that.
The gym, yeah.
Yeah.
So I'll tell you this really interesting story. We were visiting, where was that in Europe? Were there 2 brothers?
Oh yeah. In Salzburg, Austria.
Mm-hmm.
So we went to a box because of our schedule. And we went there. It's really interesting.
CrossFit's so simple. We loved it.
Yeah, it was CrossFit so
fun,
simple. It really working out.
Yeah.
The coaching was amazing.
The owner was great.
The owner was amazing. But interestingly, there were 2 boxes not far away from each other. And we happened to go to this one because our schedule fit perfectly. And I was like, why are you guys so physically close?
Mhm.
Interestingly, the difference was that one of the boxes had a competition focus, and the other one had a health focus.
Mm.
What we started realizing is that just like no 2 doctors
Yeah.
are the same,
Yep.
no 2 goals, no 2 mindsets of the owner of 2 different boxes are the same. Even though they may be having under the CrossFit umbrella, one is focused on a clientele that is in their 40s, 50s, and 60s. I'll give you a great example. So we visited Pawleys Island,
Mhm.
right?
In South Carolina.
In South Carolina. And we visited a wonderful.
Our free time, we just visit.
It's great. It's a great learning experience. You see.
Kind of track you guys on the map. I'm like, man, these guys.
Yeah. I mean, it's like a ping pong, but the interesting thing is that the owners of CrossFit Hammock are focused also on health and well-being. So they have a class only for senior citizens. So the answer I would give to that person who's like, well, my doctor said to me, told my parents that CrossFit is not right, and saying, well, you're right. Maybe one particular box is not the right for you, but there are others that may be a better fit.
Yeah.
So I think that CrossFit is very much applicable. But again, no 2 doctors are the same, and no 2 gym owners are the same. So we have to find that mix.
No, I think it's a very important point. And this is something that we've always said, right? Is that the affiliate and the health homes that get created there, if the owners choose to, are going to be a reflection of the community and the people who are in that community, right? And the resources that it has, and they're all going to be different. And I think part of our mission and what we want to do, right, and the purpose of having these discussions is when there are affiliates that are interested in expanding their skill set and their knowledge and their ability to onboard and serve these populations, that they're well equipped and they can feel comfortable and that they have the support that they need. And then it's not saying that every CrossFit affiliate should be able to, take on, somebody with, advanced metabolic dysfunction and feel completely comfortable. They don't have to, right? It's their affiliate, but there are probably a lot who do. And at least personally for me, and this is my own experience as a coach, the joy that I get seeing from somebody go from 0, right, to 1 on the scale of 1 to 10, like that is astronomical for me compared to going from 8 to 9, right?
Yeah.
And the joy.
And also in terms of what is the health benefit to that person.
Absolutely, that too. But just like the self-belief and the self-worth and just the human experience of that person, by them not feeling dependent or not in control, right, of their own health or their own life journey, giving that gift to somebody with the experience of CrossFit, I think is, for me, that's what it's all about. But I think it's very important to acknowledge that it is not that for everybody. And that's totally fine. Well, I know we could talk for hours. I would love to hear you guys give a couple examples of things that have really surprised you over this past year that you've kind of learned with the growth of GC Healthy Living that you wouldn't have expected, and what you're most excited about going forward with this aspect of your practice and its continued growth.
You can answer both.
Yeah, I mean, I think some of the best surprises have been the level of interest and enthusiasm and engagement of the patients. I mean, if you had asked me 18 months ago to convert this conference room into a gym and say, hey, why don't you convert this conference room into this gym and space, and that'll be the best way to tell your patients about what CrossFit's all about, I would have looked at you like you were totally crazy. But yeah, I mean, it happened. That's what happened. And yeah, not just for the patients, but I think the community aspect, which we always come back to, is that the patients inform the staff, and the staff inform the doctors, and the doctors then also we have some doctors now who are quite engaged, some of our younger doctors who've recently joined, and nurse practitioners. And so I just love that aspect of it, because we've talked in the past about some of the challenges of just working in healthcare, and just the mental health and physical health of our healthcare workforce, and seeing that improve as well in our practice has been really surprising and rewarding. And I think I had sort of this like hope that bringing these types of things into the practice would help raise the morale, but it's again been surprising how much it's raised the morale. So I think like some of the things is just like the degree of the success has been surprising.
Yeah.
I think the other part is just sometimes the numbers. Like I have a patient who had an LDL of 192. This is unbelievable story, but will not be surprising to you. She had an LDL of 192 a month ago. She sees Dinesh as well for her seizures. And when I talked to her about it, I said, what have you been doing recently for your diet? And she's like, well, I had gone online and studied what the American Heart Association says for heart healthy diet.
Wow. Yeah.
Eating a bunch of carbs. And so we connected her with Kim, who is one of our fitness and nutrition coaches. And I kid you not, in 1 month, her LDL has gone from 192 to 122.
Unbelievable.
And she's eating more whole foods and protein and all the things than she was ever before in her life. And now she's more concerned. She's in her 60s, but she's concerned about her physique. So she's gonna continue working with that.
Hey, whatever it takes.
Yeah. So, I mean, I think just the degree of response sometimes has been really surprising, like seeing double-digit A1Cs within a short period of time come down to normal levels. People, completely, diabetics become non-diabetics, pre-diabetes, no longer diabetes. One of the things I love to do is take patients with hypertension and have them check their blood pressure before and after the workout. And they're always shocked that it's so much lower just from one workout.
Yeah.
Just kind of those things is really fun for everyone. And the patients are so surprised by that. And then I think the most pleasant surprise is my parents have started training. And his parents too.
Oh,
so these are unexpected things, but it's been really.
I mean, the fact that my father-in-law even lifted something, I mean, it beyond the plate of food that he carries, we memorialized it in his nice movie. I mean, it really felt like he was looking at us saying, he had his nice polo shirt on and his pants on, and we're looking at him like, wow, I think the last time you did that was probably about 70 years ago when you were like at a playground.
Yeah.
But the one thing I just wanted to share with you is that the point you made at the very beginning, Tom, about pivoting and growing, you're starting to realize that even though we have so much enthusiasm and we want to make this better, like we know that using the GC Healthy Living program has proven track record, getting more patients involved is always a struggle.
And the consistency.
And the consistency part. And that's the thing that we're working on. Like, for example, any CrossFit coach knows that not one cue works for every single person. Not one progression works for every person. Our growth phase right now is trying to better understand how to communicate with a variety of patients based on where they are and what they need to help them with the right information to make their own decision. Because once they buy in, we don't have to do any work. But the moment we have to force, we know it's not going to work. So what we're trying to figure out is how do we give patients the knowledge so that they can make the educated decision like they would for any medication, any treatment, but to invest in themselves.
Yeah, I mean, that's really our focus, is that how do we educate and support our patients to maintain this consistency throughout their lives. And we talk about it a lot with them, like this is not just for when you're doing, doing your diet. You know, this is like, you need to stay connected to your coach when you're traveling. You need to stay connected to your coach when you're pre-op or post-op. These are the times when it's actually most critical. If we can figure out how to navigate these situations, then you'll be much more likely to maintain your fitness consistency, maintain your nutrition consistency through all the sort of ups and downs that are normal in life, including like celebrations and events and all those types of things. So we have 3 patients that are coming up on their 1-year mark, which is, they've been engaged for a year, which is, again, really surprising and super exciting for us.
Well, those are your case studies right there, right?
Yeah, they all have really amazing results.
You do your 1-year exit interview, right? And you ask them. Well, when you come back in a year to leave off good for us, you can tell us how you overcame these obstacles as well. You guys, I am so thankful for you sharing your time with us. It is one of, if not our most valuable resource. So I really appreciate you taking the time to hang out and share your experience. I think it's inspiring for all of us. And, you know, one of our goals is to share the different ways that healthcare providers are doing this all around the world. And you guys are a shining star for all of us. So thank you for all
the opportunity.
your efforts and your attitudes and all your hard work. I know it's not easy, and it'd be a lot easier not to do it, but it's the right thing to do it, and you deserve a lot of credit. So thank you very much.
And before we sign off, congratulations, because you are an affiliate now.
Yeah, we became an affiliate.
CrossFit. It's CrossFit GC Healthy. It's really special to be able to acknowledge that, you know, yeah, so that's really cool.
Congratulations, you guys.
I wanted to thank the both of you. I mean, if it wasn't for you, Jen, and for you, Tom, to set up the infrastructure for CrossFit Medical, I don't think we really have a lot of these connections and these networks and these resources, because what's amazing about the CrossFit Medical website and also the resources is that there's actually literature and evidence that I actually use in my patient visits. And, you know, I don't, of course, give the hard data, but like even that one topic about the health span and the lifespan, I use that so many times with my patients, and those little bits and pieces of evidence directly translates to how we talk to our patients and give them the right cue. So I want to thank you both for doing that, and also for advocating for CrossFit Health and trying to make our patients better. So thank you both.
Well, thanks, you guys. All right. Until next time.
Okay.
Thank you,
thanks,
guys.
guys.
All right.
Thank you. Have a good day. Good night. Thank you so much.
Bye-bye.
Bye.